Great. Well, we'll go ahead and get started. Welcome, everyone. I am Annika Izagari. I'm Communications Director with the Committee to Protect Healthcare, and we appreciate you joining us today during this busy holiday week. We are joined today by three physicians who will share what's at stake for healthcare in the upcoming special election in the 7th Congressional District, which is taking place a week from today. Before we begin, I'd like to note that the physicians speaking today are speaking as individuals and with the Committee to Protect Healthcare, not necessarily on behalf of any employers. So we respectfully ask that you only refer to them in any coverage as they introduce themselves and not include any employment information unless they expressly share that. So thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, Dr. Green.
Thank you, and good morning. My name is Katrina Green, and I'm a board-certified emergency physician in Nashville, Tennessee. For the past 14 years, I've cared for patients in emergency departments all over Middle Tennessee in urban, suburban, and rural hospitals. I'm proud to be joined by two fellow physicians today to discuss the upcoming special election in the 7th Congressional District here in Tennessee and what this election means for healthcare. As physicians, we know that the healthcare situation in our communities and the whole state of Tennessee is already dire. We are one of only 10 states left that have not expanded Medicaid. Because of this, we have led the country in rural hospital closures per capita, and as of 2023, close to 650,000 Tennesseans were uninsured. Tennessee has also led the country in medical bankruptcy rates. In fact, one study showed that 70% of Tennesseans were carrying medical debt. As bad as things are currently, we fear that the Republican candidate in the special election for Congress would only make it worse. Matt Van Epps has expressed his support for the big, beautiful bill, which is going to slash Medicaid funding and kick our neighbors off their health care. Nearly 70,000 Tennesseans are slated to lose their Medicaid coverage because of the law Van Epps supports. And for what? Kickbacks to billionaires? Many of the patients I see in the emergency room rely on Medicaid, which is called TennCare here in Tennessee, to help them access health care. These patients are working mothers, low-income seniors, children, and veterans. All of them are at risk of losing their healthcare access. Unfortunately, the big beautiful bill is a done deal. But right now, there are even more people at risk of losing their health coverage because Congress has so far failed to extend something called enhanced premium tax credits. These tax credits are something that 24 million Americans, including 600,000 Tennesseans, rely on to be able to afford their health care plans through the Affordable Care Act, also known as the ACA or Obamacare. Open enrollment in the ACA exchange plans is happening right now, and because these tax credits are set to expire at the end of the year, premiums are already going up for many folks. Thousands of Tennesseans will decide that healthcare premiums no longer fit in their budget, and they'll just go without coverage. And when they go without health insurance, they go without health care. These patients will inevitably wind up in my emergency department. Patients like the one I saw recently who hadn't been to a doctor in years, leaving his high blood pressure untreated and his kidneys failing as a result. Now looking at a life hooked up to a dialysis machine 3 times a week. Something that could have been prevented if he had had insurance coverage and a primary care doctor managing his blood pressure with medications. Or patients like the diabetic who has no access to a primary care provider to refill his insulin, causing him to end up in my emergency department needing an insulin drip to get his sugar under control in the ICU, only to get discharged with a month's supply of insulin and end up right back in the ER when it ran out again. I spent years training to be ready to treat medical emergencies, but what my training didn't teach me was how many patients I'd be treating with emergencies that could have been prevented if they just had healthcare access. Our patients deserve better than this. Our communities deserve a representative who prioritizes healthcare for our families, not the billionaire class. We deserve better than another MAGA Republican lackey who will make healthcare even less affordable and accessible. In Tennessee's Congressional District 7 race, the choice is clear. Matt Van Epps is okay with further stripping away healthcare access for hardworking Tennesseans. As a physician, I took an oath to do no harm. And that is why I support Tennessee State Representative Afton Bain, the candidate who will work toward a future where everyone can afford health care. Thank you. Now I'd like to introduce Dr. Obremski to speak.
Good morning. My name is Dr. Jill Obremski. I've been a board certified pediatrician for over 30 years, caring for children in primary care, in the pediatric emergency department, and in the public health setting as a leader for rural health departments across Tennessee. Like Afton, I have seen firsthand how it has become more and more difficult for children and adolescents in District 7 and across the state to receive the care they need for their families and their communities around them to provide that support. Afton stood up. I'm sorry. I agree with Dr. Green. The 7th Congressional District deserves a representative who prioritizes access to affordable health care. And Afton Ben has a record of doing exactly that. Afton began her career as a healthcare organizer and social worker. She has seen up close what families are struggling with, what it really takes to care for children. She is committed to protecting their access to the care they need. On the contrary, just days ago, Mr. Van Epps told Donald Trump, quote, "Mr. President, when I get to Congress, I will have your back 100%," end quote. But what we need, what our children need, are leaders who have our backs, the backs of families and of every child whose well-being depends on decisions made by them. And perhaps that's the issue. Mr. Van Epps does not seem to know what families in our communities are facing. When asked during an Inside Politics interview if he knew how many people in the 7th District would likely lose their current health care if the enhanced ACA premium tax credit expired, he answered, quote, "I don't know. I don't know that total number," end quote. Well, Afton knows that number. It's 30,000 just in the 7th District and 225,000 across Tennessee. This is similar to when I was at the health department. And Mr. Van Epps was a strategist for the governor's office during COVID. The focus was on keeping mayors and legislators happy, not on prioritizing the health and well-being of all Tennesseans, including children. And we can also not forget that, in addition to the loss of care due to expiring tax credits for families, another 70,000 Tennesseans may lose their health care due to Medicaid cuts in the so-called Big Ugly Bill, a bill which Mr. Van Epp supported and one Afton continues to fight against. Afton is committed to upholding children's access to Medicaid for more than 800,000 children in our state. Medicaid is a lifeline. It provides well child visits, immunizations, developmental screenings, vision, dental, and hearing care. It supports early intervention services and ensures that children with special needs or complex health conditions can get the treatment they require. These are not luxuries. These are the foundations that allow children to thrive in school and in life. Afton also recognizes that food is critical for the health of children. Hunger right now is a public health crisis. Nutrition fuels brain development, and nutritional deficiencies during early childhood can cause irreversible harm to a child's growing brain. These harms remain lifelong, and they end up rippling across our schools, our workforce, and our communities for years to come. I'm so sorry. Afton stood up for the Supplemental Nutrition Program, or SNAP, during the government shutdown. Meanwhile, Mr. Van Epp supports our governor, who would not spend Tennessee rainy day funds to feed hungry children. The SNAP crisis is far from over. Because of the Big Ugly Bill Van Epp supported, cuts to SNAP begin next year, threatening basic food assistance and the basic health needs of children for more than 2 million of those nationwide, or 1 in every 5. Pediatricians care for all children, but we cannot care for them if they cannot reach us, if they cannot get food. And the consequences are heartbreaking. Instead of seeing a nice 5-year-old for the well child check who is growing, active, and thriving, I have seen children who are fatigued, growing poorly with anemia and delayed development. Because their parents could not afford to bring them for routine care, lung conditions remained undiagnosed and untreated. These delays alter the course of a child's entire life. In the pediatric emergency department, I saw children whose simple ear infections had gone untreated for so long that their hearing was damaged and their language development delayed. I even saw an ear infection that had spread to the bones of the face, putting the brain at risk for infection as well. I don't blame their parents. I blame our legislators who have failed to ensure access to the health care they need. Our leaders in Washington have a fundamental obligation to care for us all, but especially for the most vulnerable. We do not need another representative whose professional life has been spent prioritizing political interests over the well-being of families. Afton Bain shares the values that most Tennesseans, regardless of political affiliation, hold dear: compassion, dignity, and community. Those are the values our district needs and our children deserve. Thank you. Now I'd like to introduce Dr. Andresen to speak.
Good morning. I'm Dr. Laura Andreessen. I am an OBGYN that is practicing in Middle Tennessee. Like my fellow physicians on the call, I'm gravely concerned about sending Matt Van Epps to Congress and what that will mean for healthcare in our communities, particularly for those women that I care for every day. Just days ago, Tennessee was named the worst state for maternal mortality in the United States. The national rate of women dying from complications of pregnancy of childbirth is 23.5 per 100,000 women. In Tennessee, that number is 42.1, 80% higher than the national rate. This translates into more grieving families and more infants going home without a mother in Tennessee. Abortion bans like Tennessee's are increasing maternal morbidity and mortality rates. Abortion bans made possible by the overturning of Roe versus Wade. Just this last year, Matt Van Epps celebrated the overturning of Roe versus Wade, which took away the federal right to abortion in our state and allowed our state to initiate the trigger ban that outlawed all abortions in Tennessee. In August of 2022, taking care of pregnant women in Tennessee was altered and continues to be a balancing act between deciding if I want to commit a criminal offense or malpractice. Abortion bans, which put women's freedom, health, and very lives at risk, are definitely not something to celebrate. That's particularly true as Congress continues to rip healthcare away from families. Women are going to be forced to carry pregnancies to term and without adequate medical care. In 2024, nearly half of all pregnant women were covered by Medicaid or TennCare. The Medicaid cuts under the big ugly bill that Mr. Van Epps supports will put this coverage at risk and in turn put women's health and lives at risk. And it's not just the women who rely on Medicaid who will be at risk. Everyone in every community that loses a hospital will be at risk. When hospitals close, communities die. They work at those hospitals. Their children go to those schools. We need to keep our hospitals functioning. Tennessee is already home to many healthcare deserts. Some women have to travel over an hour for routine prenatal care to give birth. The Medicaid cuts will put 9 more hospitals at risk in our state. We are already seeing the highest rate of hospital closures per capita in the country, with 15 hospitals having closed since 2012. The Medicaid cuts are only going to make this worse. Women are going to have to travel farther for care. Typically, prenatal care consists of 12 visits, and that's in an uncomplicated pregnancy. When complications rise, many women are asked to seek care twice weekly to avoid stillbirth. This can be nearly impossible when someone is trying to maintain employment or arrange for health care for other children at home. These deserts are even more concerning when it comes to cases that are emergent. When it comes to complications in pregnancy, they often include bleeding or blood pressure issues, where minutes can make the difference between life and death. I recently cared for a patient who was 31 weeks along. She had had adequate prenatal care, and she was in good health. Luckily, she presented with some very subtle symptoms of abdominal pain. She had had no hypertensive episodes prior to this. She was found to have a condition called an abruption, where her placenta was searing away from the uterus, and she would need an emergency C-section to save herself and her unborn child. Had she not had prenatal care, had she had to travel for 2 hours to even see a physician or a healthcare provider, she and her child would have died. Women, families in our communities deserve a representative who will work to protect their access to care. Given his record on healthcare, we do not believe that Mr. Van Epps will come through with this. I have personally witnessed Afton Bain fighting for the reproductive rights of Tennesseans. She will continue to fight to keep our hospitals funded and our patients access to care. Being kind and caring about others is not radical. We need advocates to keep the families of Tennessee healthy. Thank you.
Thank you so much, Dr. Andreessen, Dr. Obremski, and Dr. Green. We will now open it up for questions. If you have a question for one or any of the physicians, you can either type your question in the chat box or Q&A, or you can raise your hand and I can allow you to unmute yourself to ask your question verbally. So we'll allow a few moments for folks to be able to type those questions or raise their hands. And in the meantime, I had a question chatted to me. I'm going to put it in the box for you all to see as well. As open enrollment for the ACA marketplace continues, have you heard from any patients about their premiums going up? Have they shared that they won't be able to purchase healthcare next year? Well, that's for anyone. Again, that's as open enrollment for the ACA marketplace continues. Have you heard from any patients about their premiums going up? Have they shared that they won't be able to purchase healthcare next year?
I had a family that is very concerned that their premiums will go from $500 to $1,500 per month, which will be a significant burden for them. Their children are covered under TennCare, but the adults are not, which this could create a problem for them seeking the health care they need. And it just is going to be a situation where their children will have care, but they will not.
Thank you. I had another question chatted to me. I will put in the box. Some Republican members of Congress signed a letter last week urging the FDA to ban mifepristone or abortion medication by mail. Do you worry that Mr. Van Epps would support these efforts to restrict abortion pill access? That's for anyone, and I'll repeat it. Some Republican members of Congress signed a letter last week urging the FDA to ban mifepristone or abortion medication by mail. Do you worry that Mr. Van Epps would support these efforts to restrict abortion pill access?
I believe that he will, with his celebratory comments about Roe versus Wade being the best thing that had happened in quite some time. I think that he will support that. The movement at both the state and national level to ban mifepristone is engaged, and they're actively working to put more and more control on contraception and access to mail order abortion pills.
Thank you. And thanks for those questions. I'm not seeing any other questions. We'll allow another minute or two, though, just in case there are any follow-up questions. In the meantime, I'll also say that we have been recording this and can share a copy of the recording after. If you would like that, you can send me a chat or send me an email where you RSVP'd, and I will get you the copy of the recording as soon as I can this afternoon. All right, I'm not seeing any other questions, so we'll go ahead and conclude today's call. Thank you so much to our speakers, Dr. Green, Dr. Obremski, and Dr. Andreessen. We appreciate your time during this busy week and your advocacy on behalf of your patients and the residents of the 7th Congressional District. And thank you so much to all the reporters who were able to join. We appreciate you being here again during this busy week. So thank you so much for your time. Thanks, everyone, and have a great rest of the day.
Thank you for having us.